So today we're going to talk about PCOS a little bit more in depth than how I usually do in the podcast because I think there's a lot of misunderstanding around this condition. And it sounds silly when I say, I'm going to talk about what PCOS is because I talk about it all the time, right? But nonetheless, there's a lot of misinformation amongst patients and providers alike. So today we're going to do a super deep dive into that. And when most people hear PCOS, they often think of irregular periods, right? So it's probably the first thing that popped in your head. My periods are very, very delayed, right? Or maybe there's infertility, right? Trouble getting pregnant. But the truth is that PCOS shows up in many different ways. For you, it might be delayed periods, it may be breakouts, intense cravings. For the person next to you, they may have regular periods, but they have this like wired and tired feeling that won't go away. For others, it might be severe insulin resistance and eventually developing into type 2 diabetes, metabolic syndrome. For others, it may be increased risk severely of endometrial cancer. So while PCOS is often viewed through a reproductive lens, it's actually a very complex and chronic condition that impacts metabolism, gut health, skin, mental well-being, and inflammation throughout the body. So, which is why today I'm breaking it all down. I'm going to talk about what PCOS actually is, the latest conversations that are actually happening around renaming this syndrome, which is super interesting. And I'll be answering your top questions from our PCOS recovery program community and from you on social media. Things like whether you really need to take progestin, if keto is the answer, can you do vigorous exercise, right? And more. So stay tuned for that. It's going to be part 2 of today's podcast. But before we get there, I want to mention that I'm actually still riding on the high from wrapping up our 3rd cohort of PCOS recovery program. So we had folks that were newly diagnosed just 5 months ago to others who were navigating PCOS for over 5 years. And really throughout the past few years, we've built a strong community of people who've felt stuck, unsupported, and frustrated, and worked together to find clarity on their PCOS healing journey, powerful change and growth through daily diet and lifestyle habits. They also felt there's improved relationship with food and body, and it's all done together through a safe space. So I'm super, super thrilled with the success of our last cohort. And I want to mention that the doors to the 4th cohort opens this September 2025, and the waitlist is already filling up. I'm going to be linking the waitlist below. But if every meal feels like a bit of a gamble, if you've bounced between diets, you've felt the binge restrict cycle trapping you, right? And you just want to wake up with more energy, mental clarity, and finally feel in charge around food while actually making measurable changes in your health and well-being, then this 12-week program is for you. So you'll get access to 20 plus video modules, daily chat support, live coaching, meal plans, plus a really, really wonderful, like genuinely wonderful community of people with PCOS who just get it, So join us. I'm going to be linking the waitlist again below. Okay, so back to the scheduled programming. So what is PCOS? So PCOS is a complex and chronic condition that is fundamentally a endocrine disorder, aka hormonal disorder. This means it affects how your body produces, regulates, and responds to hormones. And at the same time, PCOS is also increasingly recognized as a metabolic condition, which means it involves how your body manages things like blood sugars, the hormone insulin, energy balance. So it's a bit of like a dual nature condition. It's endocrine and metabolic. And this is why PCOS affects so many systems in the body beyond just reproduction as well. So one hallmark feature is elevated androgens like testosterone, which can interfere with ovulation. This can also cause the cystic acne if you experience it, maybe unwanted hair growth in the chin area called hirsutism, maybe thinning of the hair on your scalp. And PCOS can also disrupt a delicate hormonal feedback loop between your brain and your ovaries. And this impacts the release of hormones like LH and FSH that actually help regulate the menstrual cycle. But things like other hormones like insulin, cortisol, thyroid hormones, they often also play a role. We know that insulin resistance is present in all body types with PCOS in about 70% of this population. And PCOS really is that like full body condition. right? Not just limited to our ovaries. So there are psychological features that come with that: mental health, nervous system dysfunction, gut health, gut dysbiosis, dermatological features, inflammation. These are very, very common in people who may have been diagnosed or struggling with PCOS. And it's serious. It's serious. These aren't just like fancy terms and like buzzwords and like clinical terms that I'm throwing at you, right? Because having PCOS, it's uncomfortable, but it also increases your risk of diabetes, heart disease, and endometrial cancer, because you're not necessarily shedding that uterine lining regularly, right, in the absence of a period. And it is commonly misunderstood and misdiagnosed. And what personally drives me nuts, and actually majority of my clients and our PCOS recovery members, is that despite all this shit show basically that I've just described to you, is a very common piece of advice people get are like, oh, just lose weight, or oh, just take this medication, or come back when you want to get pregnant, right? And this last one actually is a personal pet peeve because it is not our prerogative to just want to get pregnant anyway. So there is no one size fits all in PCOS symptom and prognosis and in treatment too. And so actually it's cool to know that because of this, there's actually growing support to rename PCOS by healthcare providers, patients, and actually advocacy associations. So Monash University, they recently surveyed over 3,000 healthcare providers and over 4,000 people with PCOS across 6 continents. And 80% of people with PCOS and 76% of health professionals agreed that renaming PCOS would better reflect the condition. It would reduce confusion and likely lead to better outcomes. So what's cool is that Monash University actually launched a new survey for healthcare providers and PCOS patients to provide input on the PCOS name change, which is super, super exciting to actually be able to contribute to this and actually see it come to fruition eventually, right? So I'm actually going to be linking the survey below. If you're actually listening and you're a dear colleague of mine and you work with many patients with PCOS, or you're a current patient or a future patient or just someone who's just struggling with PCOS, then I highly encourage you to actually partake in the survey because your voice matters. So I'm actually going to be linking that below. Okay. All right. So speaking of voices, lived experience, sharing your input, I actually asked you on social media a few weeks ago to send in your top questions about PCOS, and that combined with commonly asked questions we get asked on a weekly basis in our PCOS recovery program, I'm answering the top common questions that come up. So let's dive in. Okay. And these are answers that I usually give within the PCOS recovery program too, because a big part of the program is, yes, giving members all the tools, all the coaching support to make changes that stick and feel good, but it's also about dispelling myths and helping them find clarity and structure, right? So the first question I get asked is, why am I gaining weight no matter what I eat? So if you have PCOS and you feel like weight gain happens no matter how quote unquote carefully you eat, then you're definitely not alone, because research does show that people with PCOS tend to experience higher longitudinal weight gain over their lifespan compared to those without. That said though, why is complex, and it's a combination of internal and external factors. So weight gain with PCOS can be influenced by intrinsic, like internal factors, things like genetics. We know there's a strong correlation with weight, body size, body shape, and genetics. Hormones, maybe that insulin resistance makes it hard for your bodies to metabolize sugar, and that excess energy, right, gets deposited in organs, other organs. Metabolism, research does suggest that people with PCOS may have a lower basal metabolic rate, so slower metabolism than those without. And there's also, of course, extrinsic factors, things like environment, social determinants of health, access to healthcare, social support versus discrimination, and weight bias, which is very present in the medical system for PCOS. And speaking of another extrinsic factor, for example, eating and lifestyle habits, it's actually, I want to note that the updated international guidelines for PCOS management did a full literature review, and there is research that suggests there's no consistent major differences in both diet quality or physical activity behaviors between people with or without PCOS. So it's not simply that oh, maybe you keep gaining weight because you're eating more and moving less. Like, no, it's not that simple, right? And I think with PCOS, a lot of people get placed in terms of like individual blame around being a higher body weight. First of all, I wouldn't even say blame because there's really no problem with being at a higher body weight, right? That's not an indicator of your health status on its own. So a few things to keep in mind is that insulin resistance, like we said, is a key factor in PCOS, and that's where your body cells respond less effectively to insulin. This can lead to hyperinsulinemia. Insulin is a growth hormone, which then can promote fat storage, right? Because that excess energy isn't necessarily being moved into your cells to be used as energy, it's being stored in your body. This can be worsened by inflammation, excess androgens, genetics, or dietary patterns that are high in refined carbs and ultra-processed foods. We also know that chronic low-grade inflammation, which is also present in many bodies with PCOS, can disrupt insulin function and hormone balance. This may also cause weight changes as well. And on top of these biological, intrinsic mainly factors, many people with PCOS unfortunately have a history of dieting. And this is often driven by weight stigma, by being told they have to lose weight, by being put on different super restrictive diet plans. And then that regain happens and that repeated dieting, that weight cycling, that can not only be incredibly stressful and demoralizing, it can also downregulate your metabolism, which makes it even harder to maintain a certain body weight, right? And it's such a frustrating cycle of gain and regain. And it's actually that process of weight cycling that harms your health so much more than being at a certain or a higher body weight, because it increases your risk for osteoporosis and fractures, for hypertension, for diabetes, right? Loss of muscle mass. So many side effects of that. And it really can, weight stigma can really reinforce that cycle, right? So I just want to say here, like, it's complex. If you're someone with PCOS and you feel like weight gain is rapid, it's significant without much change, it's complex, right? And it's not necessarily your fault. And if you do want to lose weight, that's completely valid. I'm not going to stand on my soapbox and tell you, like, love your body, right? Like, we live in a weight-focused society. So yes, maybe you want to lose weight. But rather than seeing that as an intervention, can we maybe see that as an outcome and shift our focus to focusing on improving our insulin sensitivity, reducing inflammation, replenishing nutrient and correcting deficiencies, balanced nutrition, managing stress, supporting your nervous system, sleeping, right? And building sustainable habits. Weight changes may come as a result, but that's one piece and one outcome of a really, really big, complex picture. So I hope this helps foster a little bit more like a kinder approach to yourself when it comes to managing PCOS. Okay. So next question, oh my gosh, I get asked this all the time, is do I have to take progestin? Can't I just focus on diet to induce my period? Okay, so a little bit of background knowledge for those who don't know is that progestin is a synthetic, aka a man-made form of the hormone progesterone. Because having PCOS often causes irregular or absent periods, super long cycles due to the hormonal imbalance, right, the endocrine nature of the syndrome, usually this is due to low progesterone production. Some people, right, if you've gone a long time without your period, every few months, will get prescribed progestin to help induce the period if they're not ovulating. And inducing a period is very important because shedding that uterine lining helps reduce your risk for endometrial hyperplasia and endometrial cancer, right? You need to shed that uterine lining. And because I'm a dietitian who works with people to regulate their cycles to the best of their ability with nutrition and with lifestyle, I often get asked for my opinion. Like, a client will often come to me, or someone in our member in our program will ask in our live group chat, like, hey, do you think I should avoid progestin? Or maybe there's a lot of fear about taking medications and you really don't want to induce your period and you think the natural way is best. And yes, natural if possible, like natural, quote unquote, great. And diet is so powerful. Lifestyle, nervous system support is so, so powerful. And I am not by any means selling myself or our work short here, because it can change your life, right? Adjusting your nutrition. But because PCOS is a chronic, progressive endocrine and metabolic condition. It affects your body on a very deep level. And sometimes medication is not just an option, but is a necessary part of care. And I really, really think that true holistic health is taking into account the medical model as well, right? And yes, I know widely reported globally, people with PCOS report dissatisfaction in their medical care with the syndrome. There are many problems. I'm not saying here that it's, a walk in the park, right? There's many structural issues. Maybe there's not much time you can spend with your provider and they just slap on a medication without any lifestyle support. But along with true lifestyle and diet support and change, medication can be life-saving, right? And it can be a hard pill to swallow, but making all the quote unquote natural changes in the world sometimes will not induce ovulation. And that is okay, because in the meantime, nutrition can only help, and you may notice so many other small wins along the way. Things like mental clarity, better digestion, energy to focus on doing what you love, productivity, right? Improvement in your blood work, like genuine improvements, like your lipid profile, your blood sugars, A1C, your fasting insulin decrease. And you still may need to take progestin to trigger ovulation. And this is not like in my wheelhouse as a dietitian, so I'm not going to spend so much time on this. I focus on medical nutrition therapy, right? If you have any more questions about progestin, I highly recommend you speak to your physician. But I'm just addressing this because I get asked this so many times, in my opinion. So the recommendations are minimum 4 times per year. It is recommended to have a period, whether that is induced or natural. And once again, that is to reduce the risk for endometrial cancer that can come from uterine lining thickening. So that needs to shed when you bleed, right? Okay. Question number 3. Do I need to go low carb or keto to manage my PCOS? So keto, totally valid question. Might sound like a very good option because it lowers your carb intake, which then can help lower your insulin resistance, right? Less insulin response to a lower carb intake, lower blood sugars, which is a common issue in PCOS. But what I see often, time and time again, one is actually, besides a lack of data that shows that keto is effective treatment for long-term for PCOS, so the data is not there. But beyond that, the rebound effect is so common. So in all of my years of practice, in all of our years, genuinely, truly, like in our clinic, working with hundreds and hundreds of people with PCOS, I have never seen a single client case where they have been able to sustain the keto diet and feel good for over 6 months. That's not to say it's impossible. If you do it and you're listening along and you're like, screw you, like, don't tell me, like, you don't know me, that's fair, right? But that's just my experience, along with not having the adequate research to support this as a long-term intervention. And by keto, I mean very, very, very low intake of carbs. Not to mention, there is a risk for fiber deficiency. So essential nutrient for digestion, fiber is. It manages your cholesterol and your lipid profile. And we know with PCOS, there's a higher risk for elevated cholesterol and heart disease. It helps support long-term diverse and strong and resilient gut microbiome. It reduces your risk for colon cancer and more. But beyond that, research shows that the bigger picture when it comes to, let's scale it back, right, is not just carbs, but overall macronutrient distribution. I think as a society, maybe it's because in North America, I think a lot of foods that are available and affordable and easy to access for many people is ultra-processed foods that tend to have refined carbohydrates, right? So I think it's not that we need to go super low. It's that maybe an average person has a higher than recommended range of carbohydrate intake, and rather than cut it and make them feel like they should take extremes, we focus on upping the other 2 macronutrients. Because the most up-to-date literature review that ranks various dietary approaches to manage PCOS suggests there are metabolic benefits found with macronutrient ranges that are roughly around 40 to 55% for carbs, 15 to 30% for protein, and 25 to 40% for fat. So this is interesting because it's actually quite close to Health Canada's recommendations of 45 to 65% carbs, 10 to 35% protein, 20 to 35% fat. You'll just see that there is a lower cutoff range, there's like a lower upper limit for the range of carbohydrates, and lower limit, there is a higher lower limit for the protein, and a wider range, like a higher intake of fat, but it's very, very slight and very small. So I think if we're comparing the ranges, the macronutrient ranges here, the key isn't drastically changing these ratios and going super low carb. It's generally distributing it within these ranges. And beyond that, focusing on improving food quality, meal balance. And with carbohydrates, timing, pairing, and type is key to stabilize blood sugars. And by timing, I mean, let's spread out our carbohydrate intake evenly for blood sugar regulation and thus a low and slow stable insulin response. Let's pair it with protein and fat to actually slow the absorption. We digest these macronutrients much slower. Let's choose lower glycemic index carbs that contain fiber, things like pulses, whole grains, starchy veggies, fruits, right? And remember that everyone's carb tolerance is unique. It also depends on genetics, age, on activity level is a big one, right? Some thrive on a little bit lower end of the range of the carbs from 40 to 55%. Maybe you thrive on a 40%. Maybe someone next to you with PCOS thrives on 55%. Maybe someone thrives on even higher than that, right? And remember, this is just a range, right? So the bottom line is focus on adding protein, focus on adding carbs. Focus on adding protein, focus on adding fats, focus on maintaining, spreading out your carb intake with fiber, rich choices, and finding your personal carb tolerance with professional guidance, right? So this approach is very personalized, but there is a little bit of guidance. It's sustainable, and I definitely don't recommend just throwing away all the carbs and like praying for a positive outcome, because I hate to break it to you, it's probably not going to happen. Okay, and then final question is, can I do vigorous exercise with PCOS? So, oh my gosh, this myth around avoiding vigorous exercise, high intensity exercise with PCOS because it can harm your hormone health honestly breaks my heart because it makes people with PCOS, which already have so many challenges, shy away from exercise because of this myth, right? So you hear it everywhere, like avoid high intensity exercises, it spikes your cortisol levels, and that is not that simple. So yes, cortisol, the stress hormone, first of all, we actually need this hormone, right, to survive. Sometimes with PCOS, in some bodies, it's dysregulated. It's chronically high, which can leave us that like really frazzled. It can impact our other hormones. Anyway, so cortisol, it does temporarily increase during exercise, and that is a natural response and not to be feared, right? In fact, short bursts of cortisol boosts immunity. Like I said, we'd literally die without cortisol. We need this hormone. The real issue is when cortisol remains elevated for too long. And this is what can contribute to weakened immunity, actually chronic inflammation, and you're just feeling like frazzled and strung out all the time, right? Think of it like insulin. Actually, it's actually quite comparable to insulin in that it's an essential hormone, but too much for too long is when problems can arise, when it's too high. The key is not to avoid exercise. The key is recovery, and rest. And refueling and repairing. Okay, I love a ton of R's. So after exercise, like I said, cortisol is going to increase during exercise, but it naturally returns to baseline after exercise if we give the body what it needs to recover well. And this is where we're scaling it back and looking at the big picture. Is it the exercise that's harmful, or are you doing vigorous exercise fasted with PCOS? Are you skipping breakfast and really doing high output on an empty gas tank? Is it exercise, or are you not refueling appropriately with the 3 R's? Refuel with carbs, repair with protein, rehydrate with fluids. Is it the exercise that's harmful, or are you missing a grounding routine in your day? Or are you not sleeping enough? This is where your body's cells repairs, restores balance, right? So when we skip out on restoring our health with proper rest and recovery, then our hormones pay the price. So rather than fearing intense exercise, or you spend too much time choosing the best exercise for PCOS, just start moving any type, any intensity, fuel properly, sleep after, slowly increase the intensity if you'd like, repeat, right? So it's very similar to nutrition. Progress begins with informed action, not fear. So do not avoid high intensity exercise. In fact, a ton of cardiometabolic benefits with it. Just rest and recover appropriately. And actually, I want to note too, there's also, aside from PCOS, just generally speaking, I'm seeing a lot of myths online around like avoiding vigorous exercise when you have your period. It's not that it's going to harm your body. It's just listen to your body is another way to reframe it, right? If your energy is a little bit lower because your hormones are fluctuating around your period, lean into that, rest, maybe do lower intensity if you'd like. Don't push past it too much. That said, if you have capacity and you're okay challenging yourself a little bit more and you like doing exercise, go for it. Don't fear exercise during different types of your cycle. Cycle syncing with exercise is bullshit. I'm sorry. Like, that's just not grounded in science, but listen to your body, right? Is more what it is about. And think about it this way, if we're avoiding exercise every time we have our periods, that's a quarter of our month. That is literally a quarter of our reproductive years, like that we're just sedentary, right? No shame in that. Like if it's a choice, but don't do it because you're scared. Okay. All right. So thank you for tuning. I think I just got a little heated there. Thank you for tuning in and learning more about PCOS. It's a complex chronic condition that goes far beyond regular periods. So if you feel stuck or overwhelmed, know that you're not alone. Our PCOS recovery program has helped so many people find clarity, balance, and real progress in the structured coaching in the community. So doors open for our next cohort, September 2025. And like I said, the waitlist is already filling up, so I'm going to be linking it below. Okay. Thank you so much, everyone. And I'll catch you next time. Bye now.